If you've got neck and back pain, should you be using opioids as part of the treatment plan? The answer is very definitive, no. Welcome to the Crossover Connections with Jack Wang podcast. I'm Jack Wang, a scientist and college professor at Australian University. Now, the opioid epidemic is not new, but what is the headline that has emerged as new is this new study on lower back or neck pain. And I, like many of my other Gen Z millennial compatriots, I'm not in the Gen Z, I'm barely a millennial, we are at our computers and our phones all the time, so we have lower back and neck pain constantly, and it's an ongoing battle to manage that day to day. Some days it's really bad, other days it's not. I'm assuming at some point in my life will get really bad to a point where I have to consider more serious intervention other than just stretching and yoga and exercise. This study was one of the first ones to show that a lot of people who go to their GP with low back and neck pain and also visit a hospital emergency department with these conditions, they are prescribed opioids such as oxycodone. And oxycodone is the aforementioned drug that would lead to all of those opioid overdoses. Straight away, really dicey territory. Lower back pain can feel like you wake up and you can't move, so it can feel debilitating. You have to get rid of it as soon as possible. But this study published in the Lancet Medical Journal, which is a very prestigious medical journal, found that opioids do not relieve acute low back or neck pain and actually can result in worse pain. And prescribing opioids may not even impact the condition that it was trying to cure in the first place, but could cause other side effects such as nausea, constipation, dizziness, not to mention misuse, dependency, addiction, poisoning, and death. And this article really says opioids should not be recommended for acute low back pain or neck pain. And what I'm really keen to see is what is the alternative? Because again, I have nowhere near this level, but I have back pain, I have neck pain. What else am I supposed to do? I'm not on any opioids. I'm not on any other medication for this kind of stuff. But what is the alternative? Instead of just raising the problem, let's find some solutions to this situation. But the study, they compared opioids to a placebo. They had 347 people in their trial who took either an opioid or a placebo. What happened was they took it for 6 weeks, maximum of 6 weeks, and they assessed the outcome over 1 year. So it wasn't over a few months, it was over a year. So that really kind of smoothed out any bumps in the variability road. Under these conditions, the opioids did not result in better pain relief compared to placebo, nor were there other benefits such as physical function, quality of life, recovery time, or work absenteeism. And people who were treated with opioids experienced nausea, constipation, dizziness more than those in the placebo group, and it highlighted that there is potential long-term harm of opioids even with short-term use over 6 weeks, not to mention again the risk of becoming addicted to this very potent set of drugs. But the fact that this made news is because guidelines kind of go against this. The guidelines still include opioid prescription, in Australia at least, and international low back pain guidelines highlight the use of opioids, the responsible use of opioids. When other treatments haven't worked or aren't appropriate, it doesn't outright ban the use of opioids, just discourages it. And this kind of research is really trying to take it to the next step to say, look, not only should it be discouraged, it maybe should be banned for this kind of condition, for low back or neck pain, because it doesn't seem to help. Even a short-term use of the drug doesn't seem to help and has other side effects, not to mention really deadly potential overdose. Change of this kind of practice not just applies for outpatients, right? Patients who go visit their GPs, look for some advice and then leave, but it also applies for people who are admitted into emergency departments in hospitals. How that is treated under those kind of emergency conditions might be where it makes the most impact, because that is where people are in more life or death situations where the pain is a bit more severe. And even under those conditions, the use of opioids might not be preferable to something like clinical education about managing the pain, really talking about heat packs and anti-inflammatory pain medications, something as simple as aspirins, Tylenol or paracetamol or ibuprofen, Nurofen. Any of those more common pain management treatments is still better and more reliable long-term than prescribing opioids. Thank you for listening. I'm Jack Wang. Hope to connect with you again next time around.